This program is brought to you by the Ministry of Education and Vocational Training Zanzibar in collaboration with Good Neighbors. The program is funded by KOICA.
Dear listener, you may learn many useful concepts of biology in this program as far as you pay attention. However, our program today is special for Form 1 biology learners. The program will provide free discussion on A. Demonstrating necessary skills for avoiding risky behaviors, practices, and situations. Demonstrating necessary skills for avoiding risky behaviors, practices, and situations. And B. The importance of curative health care for STIs, STDs, AIDS, and opportunistic diseases. Self-assessment is allowed when the program is going on. For our lovely teacher, the program will help you to prepare a simple lesson for your students so that they will learn with joy and improve their performance.
Salma! Salma!
Yes, Mom?
Go out and take off the clothes on the rope. The weather has changed.
Okay, Mom.
Don't forget to put all the clothes in the cupboard before you leave.
Okay, Mom. The time has gone. Oh, what is in the cupboard which cut my hand? Get in, please. Oh my God.
What's wrong, Salma? Oh, you are bleeding. What have you done?
Someone kept blood in the cupboard. It has cut my hands.
Where's your mother?
She's in her room.
Go and put some spirit or iodine. You know it's very dangerous.
Is it because of this little bleeding?
Not only bleeding, Salma, but also you may be infected. Have you forgotten about this?
Come on, Musa. How am I going to be infected with this small object?
Don't underestimate things. Anyway, be prepared.
Prepared?
Yes.
You mean to go to our journey to Mr. B?
Yeah, or you have changed your mind.
No, let me finish helping my mother first. Then we can go.
All right.
Okay, let's go.
Which transport are we going to use?
Just by foot. Oh,
Let's use public transport because we will go and return in appropriate time.
okay.
We should sit here near the door.
All right, Musa.
I will pay for you.
Thank you.
Conductor, take your money and drop us to the next station.
The village of Mr. B is very big and has good conditions.
Yeah, even the environment is good.
Look at Mr. B's door. There is a lock. So,
Oh my God. It seems he is not there.
let's contact him.
All right. Hello? Hello, Mr. B.
Hello?
We are at your home.
Oh, sorry. I'm in the hospital, near to my house.
All right.
Musa,
Yes?
Mr. B is there.
Ah, I see him. Let's follow him. Hello, Mr. B. How are you?
I'm fine at least.
Don't worry, Mr. B. You'll be strong soon.
Okay, thank you.
What's wrong with you, Mr. B?
I had high fever and the amount of blood was low.
Oh, so sorry for that.
Thank you.
What about now?
I feel a little bit better now because I got medicines to reduce fever and nurse added blood to my body.
So, you said you have been added blood in your body?
Yes. Do you know the process of donating blood? How is it called in biology or in health?
Do you mean blood transfusion?
Yes. It is blood transfusion.
Huh? Mr. B, that is dangerous action.
Why is it dangerous?
Because it can cause infection.
No, it depends.
How?
Listen to me, please.
Alright, Mr. B.
I hope you know about risky situations, behaviors, and the practices.
Musa,
Yes?
I know risk behaviors and their effect to many youth. Even their practices such as the use of drugs and involved in sex. But what about risky situations?
These are situations which lead someone to harm themselves or others or becoming extremely depressed.
I heard your conversation. I like to hear them. Can you say again?
We have just talked about risk behaviors and practices done to many youth, like involving in drugs and alcohol.
Yes, Mr. B. These behaviors have negative consequences of the health of individual.
You are right. They can lead to STIs and HIV infections.
STIs and HIV?
Also, you need to know how to avoid them.
All right.
That is why the only screened blood should be used for blood transfusion.
Mr. B,
Yes?
may I ask you a question?
Why not? Go ahead.
You said STIs and HIV. What do these abbreviations stand for?
Can you try?
Yes, I can remind him. STIs stands for sexual transmitted infections.
Wow! STIs for sexual transmitted infections.
While HIV stands for human immunodeficiency virus.
Human immunodeficiency virus.
Mr. B,
Yes?
may I try to list the way to avoid risky situations, behaviors, and practices?
Yes, go on.
Firstly, do not share sharp objects such as needles and blades.
That's good. Next one.
Abstain from sexual intercourse before marriage.
Great. It's your turn to say another one.
Mr. B,
Yes?
let me add this before Musa.
Okay.
Do not accept gifts or favors from members of the opposite sex.
Very good. Can you say something?
Why not? Avoid drinking alcohols and taking all forms of narcotic drugs.
Wow. Any more points?
Also, report all cases of sexual abuse to parents, teachers, trusted persons, and police.
Sexual abuse.
Yes, for example, raping.
Then a person should go to the health center as soon as possible.
Sure. Can I add more?
Of course, Mr. B.
Thank you. In addition, avoid risky places such as bars, nightclubs, and casinos.
You are right, mister. Those are bad behaviors and practices. I remember one more.
What is it?
Moreover, keep good company. Avoid immoral friends and go out in the company of trusted family members or friends.
Fantastic.
Mr. B,
Yes?
I have the last one.
All right.
Avoid staying in very secluded areas with members of the opposite sex or strangers.
Nice one. Do you understand the importance of seeking the health care for STIs, STDs and opportunistic diseases?
I don't know.
We know nothing, mister.
Okay, we have to know that early testing and treatment helps to cure or slow down the development of the infection or disease in its early stages.
All right.
Also, proper health care reduces the chances of infecting other people. Is that clear?
Yes,
Yes.
Mr. B.
What did I say?
You said early testing and treatment helps to cure or slow down the development of the infection or disease in its early stages.
Right. What else did I say?
You also said proper health care reduces the chances of infecting other people.
Excellent. You are good listeners.
Thank you.
Now I get the point. You mean proper health care is important to reduce the chance of infecting other people.
Right. Additionally, testing gives peace of mind. It confirms whether one is infected or not, instead of worrying and guessing what the problem could be.
Congratulations, Mr. B.
Thank you.
You are so genius.
Thank you.
The time is up, Musa. Let's leave.
Alright, Salma. Mr. B,
Yes.
sorry for disturbing you while you are not okay.
Don't worry.
Okay, thank you for everything. Do you need our support?
No, thanks. I can go home by myself to rest.
Let us go, Salma. See you next time, Mr. B.
All right.
I expected you have benefited from today's discussion, right?
Of course, yes. Let me ask you one thing to check if you really benefited.
What is it?
Do you remember what STIs and STDs stand for?
Absolutely. STI stands for sexually transmitted infections.
You are right. The other one?
STDs stand for sexual transmitted diseases.
Wonderful.
Thank you.
Another question to test you. Why it is important to seek the health care for STIs, STDs, and opportunistic diseases?
Because early testing and treatment helps to cure or slow down the development of the infection or disease in its early stages.
I know. I cannot challenge you. You are intelligent.
Thank you, Salma. You are all so bright. So let's go.
Alright, let's go.
Soma, soma mwana soma, uwe mjini. Soma, soma mwana soma, uwe kijijini. Soma, soma mwana soma, ukiwa na mahitaji maalum. Soma, soma mwana soma.
All right, we were together in your discussion and I'm so happy. Hopefully, our dear listener has gained a lot through your discussion. Now, here are the questions about the topic for further discussion. Number 1. Write at least 5 points on how to avoid risky behaviors that can lead to STIs and AIDS. Write down at least 5 points on how to avoid risky behaviors that can lead to STIs and AIDS. And number 2, list 2 importances of curative health care and opportunistic diseases. List 2 importances of curative health care and opportunistic diseases. Here is the end of this program, but you are so welcomed in the next program. Until next time, goodbye.
Happy, 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 happy. Radio class. Happy, 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 happy. Happy, happy, happy. Radio class. Happy, 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 happy. be a pilot, you can be a doctor.